All right, this is our quick instructional video for how to be able to use the cervical traction device that we've supplied for you or that you have purchased on Amazon at our recommendation. Now, this is very important to know that this is for people who are dealing with cervical issues. If this hasn't been recommended to you by me, then please make sure you're working with the doctor who is the recommending doctor there to follow their protocol. This is simply ours, okay? So this is a general protocol. It has not been tweaked. So if you're having any issues with it, definitely let us know so we can make sure and just customize the care. We believe that everyone deserves that and that's how you get the best results. So this is our cervical traction protocol here, specifically to help people with neck and shoulder pain, all right, caused by primarily disc issues, okay? There's a lot of them that can be handled non-surgically, some that need to go to surgery. All right, so we're going to start out. We're going to start out with going through the protocol in time, as far as time basis, and then I'll go through the picture here. So we're going to start out by warming things up for about 10 minutes with a heating pad. All right, then you're going to do 10 warm-ups. Now the cervical traction device uses like a blood pressure cuff pump. You're going to pump that up, and then you're going to pump it up to where it's just a little bit of a stretch. We'll talk about that in a moment. And then you're gonna take a quick breath at the top and then let the pressure out, and then you're gonna pump it up, right? And then you're gonna take a breath, you're gonna let it out, that's 2. You're gonna take a breath, pump it up, take a breath, let it out, that's 3. You're gonna do 10 of those. So it should only take about 2 minutes, okay? Now there's gonna be a variable hold right over here, all right? And here's the schedule. So in week 1, you're gonna do it for about 5 minutes. In week 2, you're gonna do it for 10. In weeks 3 and 4, you're gonna do it for 15. So we're gonna ramp up the amount of stretching that we're doing. This is a passive stretch, and this is very powerfully affecting the ligaments of the spine. So early on, when people are hurting more or the dysfunction is higher, you wanna start with a lower amount of tension. Might sound counterintuitive. You might think, well, when you're worse, you need to do more. No. When you're worse, you're closer to threshold. You have less availability of input that we can put in before sending you into overwhelm. That's what we want to avoid. That's why we start out with a lower amount early. So if you get too uncomfortable before you reach this time, you decrease the pressure. If that doesn't help sufficiently, then you just go ahead and stop. This is a target. It's more like a maximum, not a minimum, more like a maximum and a target, okay? Very important. Once you're done with the variable hold, so week 1, 5 minutes, week 2, 10 minutes, weeks 3 and 4, 15 minutes, you're gonna go ahead and relax and you're gonna go ahead and ice it. Now, if you're super sensitive to ice, you can use something cooling, but you wanna make sure that you're offsetting the heat over here. The heat is pumping in a whole bunch of blood and inflammation. Now, that's good, that's short-term inflammation, but we don't wanna leave it there and let it become chronic, so use the ice as a heat pump to pump things out, okay? Now, we're gonna look at this way. So you're gonna do heat, this is gonna be 10 minutes, okay? Here you can see the tension going up, so this is tension right here, okay? You don't want things to get above a 4, okay? Not above a 4. This is very, very mild. Less is more kind of a therapy here, okay? So we're gonna go up, take a breath, come down. Up, take a breath, come down. Just like we're talking about, takes about 2 minutes. Now this get a little, to show like, well, it might be 5 minutes, it might be 10 minutes, it might be 15 minutes. I didn't want to draw out 3 of these. So you have your variable hold here where the tension's gonna go up and you're gonna hold that tension. And then if for whatever reason, like it gets too uncomfortable, you start breaking that 4 out of 10 thing, you might bring the tension down, okay? And then when you're done, you're gonna go ahead and let it out, take some breaths, and then you're gonna ice for 10 minutes, okay? I hope this is helpful. If you got any questions, go ahead and email us back. We probably emailed you this link or texted it to you, so text or email back for myself or the team. We'll be happy to answer any of the questions for you. Again, if you found this video and it was not recommended to you by us, please feel free to reach out with questions. We'd be happy to consult with you. We need to make sure that we go through an intake process and an evaluation. And if you would like to become a patient or you want to suggest this to your clinician, please feel free to share this link or this video with whoever you want to.